So what we're seeing today is that the economy is having a massive, massive impact on every person. Now it's no longer just the poor or the middle class or the rich, it's everybody. Fuel is going up tonight, as you know. So we're going to pay, 26 Rand a litre for fuel. We don't have electricity because of load shedding. That influences every business. I mean, just medical practices, we had to pay R500,000 to put in a generator that can manage the x-rays and everything. So it's becoming very costly for us as well as health practitioners. But I think what we've noticed in the past 3 months where we've been doing exercises is that people are cutting. They're cutting wherever they can. And it's now about affordable health. If you're going to start looking what you can afford, where you're going to get the best for the less. So it's exactly the same, for an example, when you go do your grocery shopping. You'll go see, right, you can buy soap powder at A for that price, you can buy bread at that shop for that price, and it's becoming of healthcare the same. It's now about affordable healthcare. It's what people can afford in the end of the day. Because the way we're going now, it's becoming unaffordable. Everything is becoming unaffordable. But with healthcare, we're going to get ill, we're going to die, we're going to get sick. So, it's becoming a difficult exercise to balance everything in life.
How much is it costing you during load shedding to keep your clinic going?
Well, before stage 6 were implemented, it still cost us between 10 and 15,000 a month just to run the generators, when we have load shedding, to make sure that all the facilities are operating, there's enough light that the x-rays can still be done, the vaccine fridges can be kept cool according to the standards and whatever. And that has started to double because diesel is expensive. So, where we could work out to say, right, a patient costs us X amount, and it covers your salaries, it covers your medical stock, it covers your building, it covers your electricity, generators. It has become a seesaw because today it will cost you 10 to run your generators for the month, but we're standing on 20, 30,000 already. It's more than doubled already. And the impact cannot be back on the client in the end of the day because we understand it's about affordability. So where do you draw the line? Where do you start pulling a line? Where do you decide what you cut? Unfortunately, Medicare had to make a decision to say, well, our times, let's cut on time. So where we were open from 7 in the morning till 8, 9 in the evenings, we're closing at 6 due to cost saving. Because if we don't do a cost saving from a business perspective, I'm going to have to give it over to the client, the end user. And the end user cannot afford increases.
There have been some real horror stories over the last couple of days of hospitals having to resuscitate people by torchlight, doctors being unable to perform operations because there just isn't enough power, or hospitals don't have the generating capacity to deal with stage 6 or stage 4 for that matter.
So you need to understand, in a hospital environment, it becomes a very difficult balancing act that you need to follow. If you do not know when the load shedding is, or it's not on the time scheduled, it's done, and you start doing an operation, you need equipment. All the equipment is generated by power. You need the proper lighting. The lighting is one of the most important things. People will think it's just a light. No, it's not. It's for that surgeon to do his job perfectly. Plus, then the person is on ventilator, a possibility. There's equipment that monitors his blood pressures, his breathing, everything. Now, you can imagine when that person is under theatre and suddenly there's no power. Everything goes manual. Everything needs to be done manually. So that basic operation can become a serious operation in the sense of that you're going to put a patient's life into danger. And that's going to have a massive, massive influence. So operations were booked from 7 in the morning till 10 in the evening, for argument's sake. Now suddenly it needs to be done according to time schedules. So where's the priority now? Who do you prioritize? It's easy to say we start with the most serious patient, but appendix can become a serious patient eventually. So where do you draw the line? And I pity the hospitals. I mean, that must be an industry of hell to work with a patient with a torch in the end of the day and to do everything manually, going back to old school, putting us back in the 1800s, 1900s. You can't do that. We need to come up with solutions. And hospitals, unfortunately, is the base of healthcare. Primary healthcare is the first step. Your hospitals for people that cannot be handled outside that type of industry. And now suddenly we're putting ourselves in more and more and more danger, because it's now safe to go to lie in a hospital. I'm not saying it's not safe. You have your private facilities that is generated, but what about the poor government facilities? You know, really, as we know, they are not up to standard. Now we're putting it in a worse condition. And that doctor that's there is taking the accountability and responsibility. Eventually you're going to have doctors saying, enough is enough. We're not taking this accountability. Because remember, the doctor is accountable in his personal capacity as well. He's registered, he's accredited by the Health Professional Council. He's covered by indemnity and malpractice insurance. So you're putting yourself into a situation where it's going to cost you more just on insurance. It happened at this point of time with the gynecologists. Gynecologists are paying so much on malpractice in the end of the day that it's becoming an industry that's sought after, because the gynecologists are saying we're not doing this anymore. It's costing us too expensive to operate. Now take power where it's your most important thing in a hospital, to make sure that person that's on a ventilator is ventilated. The person that are checked with his heart conditions through a monitor, now there is no monitor to tell you. There's only that much backup in the system left that can manage it, and it only lasts up to a point. So there is a backup for a backup, but up to what point? We're getting 3-4 times a day load shedding. So where do we get chance for the inverters or the backups to charge before the next stage kicks in? I mean, you can take it yourself. If you have your geyser, if you are on inverters or backup batteries, and you have 3 times load shedding, when you go shower now lately, it's not warm water, it's lukewarm water, because it doesn't get chance to generate heat. The same with exactly what happens in theatres. Your backup for a backup can only last up to a point, and then it's going to stop. It's a crisis.
Let's go back to affordability of healthcare. It costs a lot of money to have the flu these days. There's the medication, the antibiotics, and of course the doctor's consult. What is the average price that people are looking at now just to sort out the sniffles?
Well, if you take your local costing through the industry, it's up to 400 Rand, and that's when you get away with a good price just to see your GP. That does not include your meds. Now you're going to start doing your meds. That can cost you an additional 500 to 1,000 Rand, depending what meds are being prescribed to you in the end of the day and how aggressive they are. And after COVID, unfortunately, and still in COVID, we do aggressive management now on flu as well. So it can cost you a fortune. It can cost you up to 1,200 Rand to see a doctor with meds after being sent to a pharmacy to go fetch your meds. And you must remember, your manufacturing and your distributors are charging more now for meds due to the fact of fuel increases. So when your fuel goes up, what goes up? Everything goes up. So everything is getting more expensive. I mean, we saw already an 80% increase in the past year just on meds prices. So it's not going to get better. It's going to get worse. That's the problem.
What can people do? Go to the doctor less, self-manage flu, home medicate. What is the solution?
I think it's a very interesting question, because what we are picking up, and especially when the industry or in our personal capacities we start feeling the brunt when money is no longer available like it was, people start doing Dr. Google. We hate that. Dr. Google is not the right doctor to go see. That's the wrong doctor to go see. You know, to self-medicate is wrong, because how do you know what's wrong with yourself? You may think you have flu, but it can be underlying illnesses that are not attended to, and that can go over to something seriously. Unfortunately, you need to go see your doctor. You need to go see your GP. I think what people need to start doing is start looking for the industries that's affordable, that's making it affordable. Yes, as practitioners and owning healthcare industries, we also need to live. But it's also about give it back to the community. Make it affordable. To run an operation where you can charge the patient 400 Rand with meds include, according to the basic healthcare guidelines, that assists more than anybody can think. You know? And I think where the biggest problem is coming with every person, I do it, you do it, we all do it, when we go see our GP and we get meds, we drink the first 4 days and then we feel better. But we leave the last 3 days. Now, medicine are prescribed in the end of the day in a certain way and in a certain period to make sure that we build the immunity, that we kill the viruses or whatever is wrong with us, and now suddenly we stop because we feel better. And we always tell this for STD patients, for an example. Today you see the scars you have or the infection, you can see it physically. In 4 or 5 days it's gone. Now we stop our antibiotics. You cannot do that. You need to finish whatever you get from your GP. Finish what you have. Don't investigate yourself in the end of the day when you're ill. Rather go see a practitioner. Get it sorted.
Do you think the affordability question is going to be solved for everyone once the National Health Insurance kicks in, or part thereof?
No. My honest opinion with NHI, and I think that's an interview on its own and a discussion on its own, is bigger than any person thinks outside there. NHI is going to cost the country in the billions. And I mean, as I spoke to you previously, I've done my thesis on it, and it's unaffordable in this country. It is genuine unaffordable. And when the NHI is going to kick in, it's not going to be a question of is healthcare going to be available. It's when will you be able to see a healthcare practitioner. Remember, with NHI, it's not a question you walk into your GP's practice. You go through a call center. The call center can give you anything in 10, 15, 20 kilometer radius to go see a doctor on a certain time and on a specific time. So it's going to change the industry. It's not. Is NHI the solution? No, I don't think it's the solution. And it's not because it's self-enrichment thing that I'm trying to get out there. It's not. It's been doing wrong. We need to go look at the whole world, NHI, on their national healthcare plans and see if it's working. Look what's happening in Canada. Canada has one of the strongest NHI programs. But why is most of the people flying to the US or visiting the US and go seeing private doctors there at the end of the day? Because of the period and time period you need to wait to see a doctor. It's not because the service is bad, it's the time period, it's the funding. Look at the UK's national healthcare plan. They're sitting in a financial crisis. Look at Obamacare, sitting in a financial crisis that was closed, the healthcare from the Obamacare. So, is it affordable? It is not. We need to change our concepts. We need to change how we practice medicine in South Africa. We need to make it affordable, and when it comes to speciality, that's a different story. It costs what it costs. But primary healthcare shouldn't be a killer in the industry. It shouldn't be the one that takes all the money away just to get basic healthcare and advice and medicine. That's the problem we're sitting with.
Do you think healthcare in South Africa, whether state healthcare, which we know is already heading towards a major meltdown or crisis, and private healthcare, do you think the entire healthcare industry is heading for a bit of a meltdown?
I think we're on the verge of a collapse. I think definitely on the verge of collapse. If you take what's happening now with the Department of Health from government's point of view, they're not paying their suppliers, number one. Secondly, they're paying out hundreds of millions on liability claims that the court is enforcing now that was granted to the guys that took the government to court, and they couldn't pay it. So where do you start drawing the line? I'm telling you, the healthcare as we're seeing is on a collapse. From a government, it's going to start from a government perspective, where it's going to collapse. And that is your majority. That's your LSMs that cannot afford the medical aid schemes. Look at the medical aid schemes, the increases, the tariff hikes. It's becoming unaffordable. To give you an example, my parents is on a medical aid scheme, and it's 21,000 Rand for 2 people in their 80s. So here's the question. How much pension do you need to earn to afford a medical aid scheme? Where do you decide to cut your medical aid? Where do you go? Where do you go for proper healthcare? Don't get me wrong. Government's healthcare is on par with the rest of the world in the sense of managing patients. The doctors are good, that's there. The sisters are brilliant, that's there. But if you don't have the tools, how do you do the job? If you work in an environment that's collapsing around you, why will you care what you do? If you're working in an area that is dirty, that is unhealthy, where we have viruses growing, why would you go on? How do you think a doctor needs to feel in a government facility where he tries his best, he lives for his passion in the end of the day? And I'm not saying all doctors are there for passion, because lately, unfortunately, it became a title behind the name. It's not any longer I want to become a doctor because I want to save lives, but the majority is still there. But now that doctor that gives everything in his life, but gets stopped because of funds, gets stopped because of no equipment, gets stopped because he goes that extra mile, but when it comes to speciality, there's nothing available. Where is it going to stop? What do you think is going to happen? Your doctors are going to say, enough is enough. Look at your patriots that's leaving the country. It's your doctors. We're losing skill. It's going to happen the same what happened to Eskom. In Eskom, we had all these people that was passionate about electricity, that was engineering, that was electrical engineers. They knew what to do. They left. What do you think is going to happen to healthcare when that happens? We're going to crash. We're going to crash. Just work on the paramedical side of healthcare. There were short courses many years back, 5, 6, 7 years back, where there were short courses for 2 months, 6 months, 2 years for paramedics to be trained. That was scrapped by the Health Professional Council. It was scrapped. Now it's a degree. How are you going to send people? How are you going to employ people that want to become a medic? Take him out of his operations for 2 years, pay him a salary, pay his varsity, hopefully he pass, come back, and you have paid. It's there. We are on a main crisis we're going. Look at what's happening in Ekurhuleni. Where's the ambulance services? Province took it out. Province took the ambulance services out. So what now? Healthcare it's not a question of are we going to collapse, it's when we're going to collapse. This is a time bomb that's waiting to go off. And when that happens, we had a crisis with COVID. We need to go look what's happening in the third world countries where there is no healthcare, where healthcare is limited to the bone. Look at your diseases. Look at stupid, basic diseases like malaria that kills people overseas. Look at that. Why? Because of the healthcare collapse. There is not, you cannot walk quickly to the GP, go get your shot or your tablets for malaria, because there isn't available. It's NGOs that kick in. Now you want to tell me a country like South Africa that is rich in mentality, people that has the capacity to do a difference, make a difference, where we have buildings, we have electricity, or well, when we have electricity, that we cannot manage a basic thing like healthcare, that's not our priority. Now you want to come and you want to bring NHI into the country. I can tell you now, you bring NHI into this country, I will put my life on it. 2 years, if that long. It will be the biggest collapse that you've ever seen in your life, and healthcare will be non-existent. And then to take it from NHI to privatizing again, impossible. Impossible. It will not happen again. It will take us 20 years to get back where it was. Because what do you think GPs are going to do? Because remember, with NHI, you cannot have a practice anymore. You work under the NHI banner. So, do you think doctors are going to wait for salaries? Do you think doctors are going to wait for funds to come in up to 90, 120 days, 6 months? How do they pay their bills? How are they going to afford their buildings? How are they going to afford to their practice? How are they going to do it? It's impossible. So what's going to happen? They're going to leave the country. They have the qualification. There's a lot of positions overseas. They're going to go in a survival mode. At the end of the day, can I put bread on my table for my family? If it means I need to leave the country to do it, you're going to do it. Your family is your priority. So government needs to strategize and think about it. I understand where NHI comes from. I really do. I understand it was about political agendas. It was about why can certain people afford healthcare, why can't. I grasp it. But here's the question I'm asking. 20 years back, 25 years back, I sat on the board of OR Tambo. That stage it was called Boksburg Benoni Hospital. That hospital was one of your best hospitals on the East Rand. Why has it collapsed? Because we're putting people that has teaching degrees in positions to run a hospital. Where did you see that? What do they know about hospitals? Hospitals aren't a school. It is a school for education, but it's a business. You need to run government like a business. Why do you think companies don't want to work with NGOs when they have tenders outside? Because it's run like an NGO. It's not about profit. It's about giving a service, and if it works, it works. If it doesn't work, it doesn't work. That's where government is at this point of time with healthcare. If it works, it works. If it doesn't, tough. They're the guys with all the medical aid schemes. They have the best of the best. You need to look at your majority that's suffering at this point of time. And if we're not going to pull our fingers and say, guys, we need to stand together. Let's help government with a solution. Let's come up with something that's going to work for the population. We're going to collapse. As private practitioners, we need to see how we can assist government, but not assist them in the sense of plowing money into something that's going to be an endless pit, because that is what NHI is. It's an endless pit.